Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It is Monday, September the 23rd, 2024. So what I want to talk about is vaccines given during pregnancy, because there's been sort of an update given where we were, say, a couple years ago. There are 4 vaccines currently given during pregnancy. One of them is the COVID vaccine, which protects both the mother from severe and fatal disease caused by COVID, as well as the unborn child, at least for the first few months of life, where you're passively transferring those antibodies from the mother to the child. So again, COVID vaccine can be given anytime during pregnancy and protects the mother and the child. Another vaccine is the influenza vaccine, which also can be given anytime during pregnancy and also protects the mother against severe and occasionally fatal influenza, as well as the child, because you'll passively transfer antibodies to the child, which will then protect them in the first few months of life. So the influenza vaccine, given anytime during pregnancy, protects the mother and the child. Now, the whooping cough vaccine or pertussis vaccine is a little different. That's given between 27 and 36 weeks gestation, but again, protects the mother from severe whooping cough, for which she's at greater risk, and the unborn child, who will then have the advantage of those antibodies in the first few months of life. Now, the 4th vaccine is even more different. It's the respiratory syncytial virus, or RSV vaccine. That vaccine is given 32 to 36 weeks of gestation and is given between September and January in advance of the RSV season. Now, interestingly, that vaccine really is only for the unborn child, because that child will then receive passively transferred antibodies, which will, through the placenta, which will then protect that child during the RSV season. But mothers, interestingly, who are infected with RSV are not at increased risk than those who are infected with RSV who are not pregnant. So pregnancy is not really a risk for severe RSV infection in the mother. So there's a vaccine that has given during a specific time, 32 to 36 weeks gestation, and specific dates, meaning September to January, and is really designed primarily to protect the unborn child. And I want to emphasize that all 4 of these vaccines have been now tested in pregnant people and found to be safe, both for the pregnant person as well as for the unborn child. Thank you.